Hello there, Shubhanjan again from Physilife. If you are a physiotherapist who is into dry needling or contemplating performing dry needling, learning dry needling, you will often come across this question that can a physiotherapist perform dry needling? As a dry needling instructor, I come across these questions pretty often. Many people have the perception that physiotherapists do not go inside the body. The common question is, you as a physiotherapist, are you allowed to do any invasive procedure? To answer this, let me take you to the definition of what is an invasive procedure. I'll give you two well accepted definitions. The first definition comes from BMJ, a very reputed journal. The title of the article is "What is an invasive procedure? A definition to inform study design, evidence synthesis and research tracking." And essentially in this article, in this study, they have analyzed 3,946 papers from the last decade. So you can see the huge body of research that had gone into forming this definition, and let me read the definition. An invasive procedure is one where purposeful or deliberate access to the body is gained via an incision, percutaneous puncture, where instrumentation is used in addition to the puncture needle, or instrumentation via a natural orifice. The second definition comes from National Cancer Institute, NIH, USA, and they essentially say the same thing, that an invasive procedure is a medical procedure that invades or enters the body, usually by cutting or puncturing the skin or by inserting instruments into the body. So essentially this is also the same definition where you are either cutting, puncturing or going through an orifice. Now when you consider natural orifice, we have done it for a long time. We have applied suction tube through the patient's nose to clear the chest secretion. Often we have used the suction tube through the mouth. We may have used the suction tube through the trachea. Whoever are the physios who are working in the ICU field, you have all done invasive procedure. If you are a musculoskeletal physiotherapist into mobilization, you must have mobilized the coccyx through the anal orifice. If you are working in the field of, if you have ever got a patient for temporomandibular joint problem, you must have wore a glove and gone inside the patient's mouth and you have mobilized the temporomandibular joint. Which means that as a physiotherapist, day in and day out, you and I perform invasive procedure. Now you would say that it does not really add up, it does not compare. You put a cotton bud inside your ear and that is also invasive, and you are talking about inserting a needle through the patient's intercostal spaces. The risk is much bigger. I agree that insertion of the needle and insertion of the say finger in the patient's mouth is having different degrees of risk. So let us talk about needle. Who else uses needle apart from the physicians and the nurses? The other professionals, other medical professionals who use needle would be the phlebotomist. Also the radio technicians inject a lot of dyes inside the patient's body before doing the radiographic procedure. So okay, one more is the EMG person, the person who performs EMG NCV, they also use needle. And as a physiotherapist, I would like to believe that you and I have much more understanding of the human body and the risks involved in inserting the needles. But then let us not stop in the healthcare domain. See who else uses the needle. A tattoo artist who applies tattoo, which is not only a needle but also an ink in the patient's body. He uses needle in the patient's body. A piercing artist, I don't know if you can call them piercing artists, but whoever does body piercing, those are the people, they also insert the needle in ear, nose and nowadays in which all places. So if these people are using needle in the patient's body, in their client's body, patient is a wrong term in this context, you and I who have undergone thousands of hours of training are well justified to use the needles in the patient's body. Now the next question comes in the form of, but is dry needling within the purview, within the scope of your form of therapy? To answer this question, let me take you to a document released by World Confederation of Physiotherapy, WCPT. This is WCPT guideline for physical therapist professional entry level education. This was given in 2011 by WCPT, so already more than 10 years old. And in that document, if you search dry needling, you will get to see that the dry needling is listed under mechanical modalities. So WCPT propagates dry needling. American Physical Therapy Association, APTA, has a clear-cut guideline related to dry needling. American Physical Therapy Association also essentially recognizes dry needling as one of the modalities that are used in physiotherapy. So if you as a physiotherapist are using dry needle, be confident, take enough training, because it's an advanced form of manual therapy that needs you to spend time with the needle. It cannot be taught in 1 hour, 2 hour, 10 hour, and that's why it is not in your BPT syllabus, which is already heavily loaded. But it is within your scope of your practice. If you have enough skill and understanding, you can go ahead and needle, and you are going to give wonderful results to your patient.